Have you ever thought that there's more reasons to use kettlebells than just becoming really ridiculously good looking?
I'm pretty sure there's a lot more to life than being really good looking.
We also have to worry about what's going on deep beneath our skin, in our blood, in our organs. Well, you probably already know what diabetes is. It's a chronic condition where essentially there is just too much sugar in your blood. In simple terms, your body becomes more and more incapable of dealing with carbohydrates, so that's anything from rice, bread, pasta, sugar. And if your body can't process carbohydrate and sugar anymore, it can't be stored and it can't be used for energy by your muscles. And so it kind of hangs about aimlessly in your bloodstream. As a direct cause of having uncontrolled type 2 diabetes, people can lose their eyesight, suffer serious nerve damage, full infections around their feet and hands, which can often require amputation if it's not caught early. So how do kettlebells actually keep diabetes at bay? When you do exercise, especially hard exercise like kettlebell training, your body uses this excess sugar that's hanging around aimlessly in your blood for energy. This immediately reduces your blood sugar levels, which is obviously a big win, but it's not just that. Exercise causes your body to become better and more efficient at dealing with sugar that you eat up to 24 to 40 hours after you've worked out. So this means if you burn off excess sugar and your body becomes better at dealing with that sugar for the next day or two, you have less sugar left in your blood, therefore your blood sugar levels are by definition lower. The second reason is that kettlebell training builds muscle. Where do you think sugar and carbohydrate is stored in your body? Well, it's mostly stored inside your muscles. The more muscle mass you have, the more places your body has to put and store this excess sugar. And again, this means that less sugar hangs around in your blood to cause problems. It can be stored somewhere, it can be used, it can be taken out of your bloodstream. And thirdly, kettlebells burn calories. They actually burn quite a lot of calories, and this helps support a healthy weight. It's not going to be the driving force of people losing body fat, but it makes it easier to put your body into something called a caloric deficit, which means essentially you burn more calories than you eat. When this happens, you lose body fat. Obesity is heavily linked with type 2 diabetes. The more body fat someone has, the more chance of developing type 2 diabetes that person has. So those are three main ways that kettlebells can, without even discussing nutrition, drastically reduce your risk of developing diabetes. I've just finished reading this book, Bury My Heart at Wounded Knee by Dee Brown, and it's a pretty good book. It's about all the different indigenous tribes in America during the late 1800s. And there's a Native American tribe called the Pima, native to what is now Arizona and northern Mexico. And their lifestyle traditionally is built around traditional agriculture, subsistence farming, long distance walking, hunting and foraging, all that kind of stuff. So historically, this population was lean, fit, relatively strong, and highly active. But in the mid-1900s, they became one of the most studied populations in modern health science because the same population split into two. You had the population who were north of the American border, and then you had the population who were still in Mexico. And between the two populations, their lifestyle changed drastically. In the late 1800s, the US government diverted the main river that was used to irrigate the crops that they were farming, and the Pima's ability to farm completely collapsed. Over the following decades, their activity levels plummeted. Government food rations replaced their traditional diets, and these rations were often processed and fairly high calorie. And the Pima who were in the USA had some of the highest rates of obesity and type 2 diabetes in the entire world. However, the genetically identical Pima living in Mexico had extremely low diabetes rates. Exactly the same genetics, completely polar opposite rates of diabetes. In the Mexican villages, the Pima continued their subsistence farming. They ate mostly traditional crops, high fiber diets, they maintained high activity levels. So the point I'm trying to make is, yes, people may be naturally more predisposed than others to have higher blood sugar and therefore be more at risk of diabetes, but it is by no means destiny or fate, and lifestyle matters so much more than your genetics. So key takeaways from this video is that kettlebells can build muscle, which acts as extra storage sites for excess sugar in your blood. Doing high intensity kettlebell workouts uses up excess carbohydrate in your blood as fuel and makes your body better at dealing with it, and it burns calories, which can help you to lose weight and maintain a healthy body weight, all three of those things drastically reduce your risk of developing diabetes. And the second point, genetics does not matter nearly as much as you think, and your lifestyle, the things that you do every single day, the things you do every single week, not just for 6 weeks, but over years and decades, is really what's going to be the deciding factor in your health and fitness.